Hilary. I'll be your MC for today. I just wanted to welcome everybody to the webinar, to the meeting today. Thank you for joining us at least this morning. We know everybody is usually busy, but at least we wanted to at least give thanks to anybody who's able to tune in, listen in, and follow up with us. Today, our event is organized by Lupus Ascending Foundation, and it's focused on nurturing holistic care for young people who battle lupus. So this event is part of creating awareness and sensitization on the impact of lupus in the lives of young warriors, their caregivers, and the support system that they need to weather this storm. So today we have two amazing speakers, Dr. Angela Migowa from the Hope Arthritis Foundation, who handles pediatric lupus and adolescent medicine, and Mrs. Caroline Okumu, a counseling psychologist who focuses on individual and group wellness. I think the first person you had seen, that was our Dr. Angela, and Mrs. Caroline will join us. We'll have a bit of a moment a little later. So the goal of this event, just let me summarize, is firstly for people to know and understand the signs, symptoms, and management of lupus, especially in young people, which is a group that's usually overlooked. And then secondly, it's for people to understand the toll that it takes on young warriors on a psychological, emotional, spiritual, and physical standpoint, and how best to support them. And how this toll is also carried by their loved ones and their carers and people within their families. So we really hope this event will build more support and awareness and compassion for those people suffering, and also these people, the young warriors dealing with this in the various settings that they're in, as well as their families and their support systems. So I want to give a brief moment for our speakers to introduce themselves, give them a bit of time, like 5 minutes, to give us a short background of who they are, what they do, why they like it, and what drove you to participate today. And if you don't mind, I can start with Dr. Angela. Good morning.
Yeah, good morning. Thank you so much. Hi, thank you. Thank you so much for the warm welcome. And again, a big thank you to all the organizers of this session for inviting me to this wonderful presentation. So I'm Dr. Angela Migowa. I'm a pediatric rheumatologist, and that's the field of medicine that focuses on taking care of children who have rheumatology conditions like lupus. And why I do what I do, as you'll see when I share the presentation, I was actually inspired by the children themselves. And I'll share that in my presentation. And I think this is a very noble move because these non-communicable diseases in our children is overlooked and underestimated. And I'm happy that the organizers are focusing on the silent burden of the emotional, psychological, and even spiritual challenges they face. And because of that, and because I share in your vision and mission, that is why I'm here today. Thank you.
Asante sana, asante sana. Is Caroline available? I don't know whether she can give us a brief introduction.
Yes, Hilary, I'm here. Good morning. Good morning, everyone. Yes, I'm so excited to be here and grateful for such an event. And like you and like everybody else, I'm here also to learn more about lupus and more about how it presents itself. I am a counseling psychologist by profession, and I work with a range of people, adolescents, young people, and even the elderly. My area of focus is trauma counseling. Why I'm here, why I decided to join the event is because I once journeyed with someone who is living with lupus, and I got a glimpse of the struggles they go through every day, and being an illness that does not have sometimes physical signs, it's difficult for someone to understand their journey. And therefore, I'm here because of that person. I'm here to learn more and to be able to support others who are going through the same. Thank you.
Thank you very much for that, for your introductions. Karibuni sana also. So I think with that, we can go back to Dr. Angela with your presentation. If you're ready, we can proceed.
Okay.
The floor is yours. Yes.
Thank you. Thank you so much. Let me just let me share my slides. Okay, are you able to see my slides?
Yes.
Okay.
Yes.
Great. So once again, good morning, everyone, and a big thank you to the organizers of the session for inviting me. And in a special way, I also want to honor each and every person who has logged on for this presentation. And I was requested to talk about the risks, the signs and symptoms, and management of pediatric SME. I shared with you that I was inspired to be a pediatric rheumatologist when I encountered 3 children who have put the acronyms of their names on this slide, because I was moved by their zeal and determination to fight lupus. They were very young, between the age of, I believe, 6 and 12. And I could see how, at that time I was in my training, I could see how other healthcare colleagues were struggling to care for them. And then I wondered, isn't there a discipline that focuses on taking care of children with diseases like lupus? And then I was fortunate to get some sponsorship with the university in Canada. But before they even offered me the sponsorship, they actually came to Kenya on a fact-finding mission to find out, if I trained, will I be able to come back and help? And the responses they got from many institutions was like, these are not problems in our context, in our country. Somebody even said in his 40 years of practice, he's never seen a single case of pediatric rheumatology like lupus. But the words of my supervisors then inspire me to move forward today, and I'll share them with all of you, because you might be in that space where you feel like this is almost a hopeless war, we might not win this battle. But my supervisor said that, Angela, even if we will train you to save one life of one lupus patient, we are ready to invest in you. So our struggles are not in vain. Let's continue working together to improve the lives of these children. So Hope Arthritis Foundation is a non-governmental organization that aims to promote holistic care for children with rheumatic diseases across Kenya and Africa through mentorship, academic leadership, and psychosocial support. And we envision a world where every child with rheumatic diseases will thrive. We look to work with the guardians and parents of these children, their health workers, and ultimately the health institutions where they go to seek care. And a lot of the things we do focuses on research, education, and advocacy, and I'll share some of those programs later. I'll begin with a quote by the founding father of the Republic of Tanzania, Mwalimu Julius Nyerere, who said, "There is no time to waste. We either unite now or perish." So I want to applaud the people who have convened this session, because this is the way we will move forward if we are to make significant strides for our children, is by uniting together and creating a sense of urgency. We don't want our agenda to be postponed. We want the issues of our children with lupus and other non-communicable diseases to be on the top list agenda of stakeholders in health. So the objective of this session is to understand what are the risks involved in development of lupus, and to be able to recognize the signs and symptoms of pediatric SLE, and to really understand what are the management strategies that are involved. And this will be the outline of my presentation. So SLE is described as the prototypic autoimmune disease as a result of production of autoantibodies to cell nucleus. Now that sounds like a lot of medical jargon, but the hallmark of this statement is to say that all of us have been gifted with a natural army. We call it the immune system. And this natural army, you can think of it like the KDF, right? It's supposed to protect us from external threats, you know, like the way we can have the Al-Shabaab coming to attack our country. So in this case, it would be like the germs that cause infection. And this army should also protect us from internal threats, just like the way amongst us Kenyan citizens, we can have a few citizens who want to cause chaos for others. And so in SLE, what actually happens? The natural army of the body, the KDF of the body, gets confused. And instead of focusing its efforts to fight the germs that cause disease or the abnormal cells in our body, it begins to attack the body itself. And you can think of it like our KDF fighting the citizens. Yet the citizens are not a threat to the country. So that's the key problem in SLE. I put up this map just to show you that wherever you are, you're not alone. Because in a conference we had in South Africa among rheumatologists, and they were mapping to see where is it that they have found cases of lupus documented. And you can see across various countries in Africa, they are documenting cases of lupus. So you're not alone in this, and there are many other people across this continent who also are doing their best to conquer the disease of lupus. I thought it would be good to share this image so that we can understand what are some of the risk factors that are involved in the disease process of lupus. Now, remember I said that your natural army immune system, or your KDF, should protect you from external threats like the viruses and bacteria. And it should also protect you from internal threats. And one of the greatest internal threats is what we call apoptotic material. This is another big scientific name just to say, you know, all of us, our cells go and our organs go through natural regeneration, meaning some of its components must die and a new one formed. Yeah, that's why the skin you had 10 years ago is not the skin that you have today. So during that regeneration process, we normally have some dead material that is there in the body. But normally your defense system mops up that dead material. So that dead material is what we call the apoptotic material. And it's normally mopped up by different soldiers in your natural army. Yeah. And just like the way in the army you've got lieutenant, major, general, cadet, we have the same cadre of fighters in our natural army. So at the very bottom of the hierarchy is what we call the dendritic cells. And this is normally the first line of defense, right? And when they detect any external or internal threats, they mop it up, right? And they don't work in isolation. So they communicate with the officers in higher command. And those officers in higher command are what you're seeing here, the B cells and the T cells. And then when they communicate with the officers of higher command, the officers of higher command then send more soldiers, more weapons to support them in their efforts to mitigate or to overcome the internal threats and the external threats. Now, in lupus, what happens? This whole communication process is so confused that now these army soldiers produce weapons against your own body. And so what are some of the risk factors? The risk factors are that the genetics that determine, genetics is like the coding in your cell. The coding in your cell that helps your soldiers focus on the right target is abnormal, okay? So they are unable to focus appropriately. Another risk factor that triggers people to get lupus, we know, is sunlight, right? Because sunlight leads to increased generation of the dead material in the body. Another trigger that can tip you off to get lupus is infections, especially when your soldiers are confused, all right? So those are some of the risk factors involved. Now, remember I've said you have now your natural army that is confused, and it is now attacking your cells. Yeah, and you can think of your cells like the building blocks of your body, just like the way a house is built of stones. So the building blocks of the body are what we call the cells. So you have a situation where your natural army is fighting all the cells in your body, from head to toe. And so what are the signs and symptoms you can see because of this attack on your cells from head to toe? It can be very subtle, like loss of hair. But this has to be out of context of the norm. Most of us, when we comb our hair, it would fall off, right? Or if you're holding your hair all the time as a ponytail at the back and you pull it, of course you would lose hair. But this is like out of context. You know, maybe you're just sleeping and you wake up, on your pillow, you see a lot of hair on your pillow. You know, that should raise a red flag. Other subtle things are you could just have this dull headache that nobody can figure out why. Sometimes it's even for the children, their concentration goes down. So somebody was doing very well in math, very well in English, in Swahili, and all of a sudden concentration goes down. But remember, you always have to look at the context of the child. Make sure you've ruled out other things that can contribute to that. If somebody is having poor concentration in maths, for example, find out that they don't like the teacher, are they experiencing some bullying in school, right? And I think this is where the challenge comes in, because people are trying to figure out what else could lead to these symptoms. Other things that they can have is the classic butterfly rash, and we'll see some examples. And this is a rash that goes over the cheek, over your nose, and to the opposite side of the cheek, but the creases around your nose are normally spared. You could have sores in the nose or the mouth. You could also have fever. They could have very vague symptoms like chest pain, difficulty in breathing, tummy pain. When it's cold, their fingers can change color. Their joints can be swollen and painful. They could have weakness in their muscles. Sometimes they have problems in the kidneys, so they're not passing urine well. So you can see most of the time, these symptoms can look like symptoms in many other diseases. But then I'll be sharing with you, then how do you narrow down on the possibility that this could be lupus and not just a flu, you know, or a pneumonia. So now we're going to some pictures. This is an example of a malar rash. You can see there's a rash over the cheeks, goes over the nose to the opposite side, but the creases around the nose are spared. This one is showing an example of a sore that you can see on the roof of the mouth. And the interesting thing about this sore, it's not painful. So they will not even know it's there. So if you don't look, you won't see. They can also have this rash with scarring, right? Which people could be treating as allergy. And the lupus rash can look like so many things, and we'll be looking at some examples. This is another child who had the same malar rash, but you can see it's not as consistent. And you can see even she's having a similar rash over her eyebrow. Sometimes they can just have this redness at the tip of the nose. Yeah, this is an example of somebody who's having loss of hair. especially at the hairline, yeah, which is not really in keeping with what you'd expect, even if you are to hold your hair all the way back. Yeah, you can see another rash here that looks like it has got some scarring. You can look at the hands and see this rash that looks like there's scarring, or like they got burnt and it's healing. And many times these are children who are treated like they have eczema, right? But this is not a common area for eczema. So for us who are in health, we know the common areas for eczema, like around the neck, the elbow, behind the knees. It's not typical to have it over the fingers. Yeah, another patient with that rash, lupus rash. And there are normally 3 types of lupus rash. There's one which we call the acute lupus rash, like the butterfly rash. Then there's what we call the chronic lupus rashes that normally come with scarring. This is now another example of a butterfly rash. And you can see over the cheeks, over the nasal bridge, onto the opposite side. Yeah, you see another format of the same rash. It might not be as, oh, sorry, let me go back. It might not be as, you see, this one is like smooth and continuous. And then the next one, it appears like it's not as continuous with a few patches. And you can see it's also happening over the forehead. This is now what we call the subacute lupus rash. And typically what happens, they normally have a rash that has like a red border. In our dark skin, it could look purplish or even just increased darkening. And then the immediate section after it is lighter, and then at the center again another darkening or reddening. And we call this the subacute lupus rash. It can affect the blood vessels. Remember, we said that your natural army, the immune system, or the KDF of the body is now attacking the building blocks of your body, everywhere from head to toe. So because the blood vessels can also be affected, you can see the fingers are beginning to die off because there's no blood supply. This one is a bit in the early stages, yeah, when the blood supply to the tips of the fingers has just started to be affected. And if not controlled, then it will progress on to this presentation. Sometimes you can have like a lace-like pattern over the skin. And someone can say, oh, this just happens when it's cold. But if this kind of pattern persists, it's really important to seek the help, the opinion of a rheumatologist or a pediatrician for them to understand what's going on. It's an example of someone who just began losing hair, and you can see it was mainly at the center of their head. This is another rash you can see on their palms and toes. They appear reddish, but when you press on it, it doesn't even disappear. We call this a vasculitic rash. Another example of a lupus patient I saw, and the blood supply to her toes was affected, and you can see some of the toes were beginning to die off. So how then do we diagnose lupus? All these symptoms, there are so many other conditions could give this. What do we do? So there have been various criteria. And the good thing about this is that these things are available online. You don't have to literally cram it. And we look to see if you achieve a certain score. So this was one of the oldest criteria. When I was in my first degree of medicine, this is what we were using. And then when I was doing my master's in pediatrics, this was the next criteria we are using. But now, the criteria that is used globally currently is what we're calling the ACR-ULI criteria. And in this, what happens is that we look at the signs and symptoms, and we try and see if you achieve the score that would put you in the category of a lupus patient. But the entry point is that you have to have anti-nuclear antibody positive. And what does that mean? The antibody are some of the weapons that we produce, the army produces to fight, yeah? And they are special proteins. So in lupus, you actually form proteins against the central part of your cell, yeah, which we call the nucleus. And you can think of the nucleus like the CPU of the computer. You know, the computer without the CPU, it cannot function. right? Or our bodies without the brain cannot function. So the brain of your cell, or the CPU of your cell, is what we call nucleus. So in lupus, the patients form weapons that fight this CPU, that fight the brain of the cell. So the first point is that it's important that you have evidence that the patient is ANA positive. And there's a way they measure the concentration. The concentration should not be less in 1 in 80. And if you have that and you can get a score of 10 points, and this is like the marking scheme. If you have fever, you have 2 points. If you're having loss of hair, 2 points. If you're having problems with your joints, whether they're swollen or painful, 6 points. If you're having seizures, psychosis, you can see the marks there. If you have kidney involvement, sometimes they have to do a biopsy of the kidney. So if you just have kidney biopsy and ANA positive and the biopsy shows evidence of lupus, then that's you meet the criteria. And then these are the other lab investigations that we also do. And so if you meet a score of at least 10 plus ANA positive, then you can make the diagnosis of lupus. Now, when we manage lupus patients, and this is really important, our goal is what we call remission. We don't talk about cure, because if I'm to cure you, I should give you a new army, right? A new defense system, but we don't have that capacity. So what we do, we retrain your army. And when we retrain your army to the point that it is still strong to fight infection, but it's not too hyper to fight the body, then that is what we call remission, right? And I'll tell you the medicines we use for that. But over and above that, I think it's important to also focus on what can we do to prevent the disease from worsening. And one very important thing is sunscreen protection, because we know that the rays of the sun make the disease worse. So to protect yourself from the sun, you can wear a hat and long-sleeved clothes. If it's possible to get sunscreen, they should apply sunscreen with the sun protection factor of at least 50. So you'll often find a number on your sunscreen, SPF 50 or more. And it should also have a physical barrier like titanium and zinc. And you should apply it 30 minutes before you go out to the sun. And it is everywhere that is not covered by your clothes. So sometimes I get patients and I say, oh, you know, it's June, July, it's cold, we don't see the sun. And I tell them, no, as long as there's daylight, it means the rays of the sun are penetrating through the sky. So those rays is what we want to protect the children from, because it makes their disease worse. Now, many lupus patients are often on other medications like steroids that can weaken their bones. So another very key thing is to optimize on vitamin D and calcium to strengthen their bones. And vitamin D now we know is so important in how your natural army operates. So it's not just critical for the bones, but it's important for your effective functioning of your natural army. We said infections tip over our patients to have the worsening of their disease. So vaccinations to prevent infections is important. Now, for our children, we know in the long term, they are at risk of other things like hypertension, a long-standing heart disease. So we emphasize that they begin a healthy lifestyle early, meaning eat healthy, sleep. I'm very passionate about sleep, because if you don't sleep enough, we now have evidence, it puts you at risk of hypertension, diabetes, hyperacidity, and even some cancers. So good quality sleep is important, or about 8 to 9 hours. Eating healthy is important. Developing a regular exercise regime is also important. Now, of all the medications we give our lupus patients, the one that we know all of them will take for life is hydroxychloroquine. And this is a medication which was used in the past for malaria, but it has so many benefits, right? And one of the benefits, well, these are many technical terms, but the benefit of hydroxychloroquine is it helps in regulating how the natural army works. from how the natural army identifies danger to how the natural army, our natural army, develops the weapons, to how our natural army executes its function in defense, right? That's how hydroxychloroquine works. I think the other thing I need to mention is, depending on which other organ is affected, we can add other medications, right? So if you're having arthritis, for example, and muscle disease, we add a medication called methotrexate. If you're having problems in your liver, we add another medication called azathioprine. So the other medications we add depend on which organs are affected by the lupus. I don't know whether the questions will be now or later, but this was to summarize, to let us know that patients who form lupus, often there's a risk that comes about because of the coding of their natural army, how their natural army develops from inception. And in the backdrop of that defective natural army, certain triggers in the environment, like the sun, infection, provokes their army to develop weapons that fight the body, even when the body is not a threat. And if we don't stop this abnormal attack on the body, then we have tissue damage. It's important to remember that in children, lupus tends to be more severe than in adults. And so it's often important that we be quick and swift in our management. And when we manage remembering that these are children who are still growing, so we must protect their growth. They could be future parents, so we must protect their fertility. And at the end of the day, we want them to develop like all other children, that they can play, feel loved, welcomed, and appreciated. And what are some of the strategies moving forward? And I want to celebrate the organizers of this session, because this is how patient support groups and patient education and monitoring begin. And this is really important, because it doesn't matter how many degrees we will have in this field, but it is the wearer of the shoe who knows where it hurts most. And that's the power of the patient support groups. You have the opportunity to use the power of your voice to tell your story and to convince people that this agenda is critical to feature in the health priority of various nations. The health workers, they need support by availing algorithms so that they can know, if you see a lupus patient, this is what you do. If this is the sign and symptom they have, this is how you support them. Ultimately, for the larger health ecosystem, it's important that we generate data so that people can understand the burden of the problem, so that we can collaborate more and look for solutions applicable in our context. At Hope Arthritis Foundation, some of the things that are available, if you visit our website, you'll be able to do a free online survey that can show you what are some of your learning needs. We have been running this masterclass, ABC masterclass, and the goal of this masterclass is to show people that you don't even need fancy tests to make a diagnosis. If you just take time to listen to the patient and examine them thoroughly from head to toe, you can come up with the possibilities that are affecting them and save the families the tragedy of sending them for investigations everywhere, spending a lot of money with no solution. We're going to be launching soon a pediatric rheumatology bootcamp, where we're going to be talking about the top 4 conditions in pediatric rheumatology, which includes arthritis, lupus, what we call myositis, muscle disease, and vasculitis, blood vessel disease. And so those who would be interested, you can look out for this and sign up, and we'll be talking about their signs, symptoms, and management strategies. Another product that we're going to be launching soon is therapeutic patient education. And here, we aim to educate the children about their disease, whether it is lupus or arthritis, about their disease, the medicines they take, the side effects, and we educate them using play, games, and toys. We also have a virtual support group for those who sign up for some of our products, where we can continue offering new advice and help as needed. And those are some of our websites, the link to our website, and email for further queries. So I'd like to finish with a quote by our own Nobel Peace Prize winner. I've drawn a lot of inspiration from her. I remember as a young girl seeing her fight to protect the trees, and I used to wonder, this is amazing that she can be so devoted just to protect the trees. And now I find myself in the same sphere, but trying to defend child health matters. And she said, we cannot tire or give up. We owe it to the present and future generations of all species to rise up and walk. So whichever challenges we face in our own spheres, let's not give up. What we are doing today will create a platform to make lives better for our children in the coming future. Thank you so much, and that marks the end of my presentation. Thank you.
Thank you very much, Dr. Angela. That was a fantastic presentation. Very informative. We'll also, I know that you had a section for questions, but
yes,
also
people,
the
whether it was now or later. Yeah.
Yeah, I wanted to just give the participants some heads up. We wanted to give also Caroline some opportunity to speak, so that we'll open the floor to questions to now both you speakers after now. She's had a moment to speak. So if they don't mind, they can just note their questions, or if they want, you can even put them in the chat. We'll now try and assist. We'll try and put them together and direct them to either Dr. Angela or Caroline. Thank you very much for that presentation. Caroline, I don't know if you're ready.
Yes, I am, Hilary. Thank you so much.
Asante sana. The floor is yours.
Thank you so much, Dr. Migowa. I've learned a lot. And as I was listening to you, I was imagining, oh my goodness, a child can go through so much pain when diagnosis is delayed. So thank you so much for teaching us. I've really learned a lot. And at this moment, I'd like to share screen as well. Let me know if you can see it.
Yes, it's visible.
Thank you.
Yeah, you can maximize too.
Okay. And so now we get to talk about the holistic care and management for both pediatric lupus warriors and their caregivers. And we begin by, first of all, understanding that lupus causes great emotional and mental and spiritual burden to the person experiencing it and to their caregivers. And for a child and also a caregiver, you may notice that someone is going through moments of emotional turmoil, and they could be experiencing anxiety, fear, grief, depression, and a lot of stress. But then where do these emotions come from? And for the warrior, for the child, the adolescent, sometimes it is because of the diagnosis, wondering why me? Why am I different? Why am I the only one having this and not anyone else? The effects of the disease in the body, or even the treatment, as we have seen from Dr. Migowa's presentation, it can really affect the physical body if diagnosis and treatment is delayed. There is pain and fatigue, pain that only the child can describe. And since it's not perhaps showing in the body, depending on the stage or the treatment that this child is going through, someone else might not be able to understand fully when they say they are in pain. And you will notice that children and even adolescents will tend to self-isolate. Sometimes going to school is affected, they miss forgetful, they are always sickly. So you find their friendships, their social life is affected. And there's also the cases of being frustrated because they find it difficult to concentrate, difficult to think through things, or even finding themselves forgetful. And as I mentioned earlier, there's that fluctuation of emotions. Today, the child could be okay. A few hours, they are feeling down, they're feeling low, they are angry, they are confused about what they are feeling, what they're experiencing. And this also limits their interaction and engagement in many activities. Sometimes it could be through because of the pain. Other times it could be because of the stress of having the disease. And then there is also grief and loss. This grief and loss is shared among the warriors and also the caregivers. Grief and loss of what would have been if they were healthy and if they did not have the diagnosis. And for the carer, there's always some level of uncertainty about the future. What will happen to their child? How will their life be if they're not there to take care of them? Sometimes there are financial challenges. I don't know how much it costs to go through the treatment, but I can only imagine it might be costly if the disease has attacked other cells in the body, and so there are more tests, there are more treatments and medications to be taken. And then sometimes some caregivers feel they lack social support, they lack that friendly ear, they lack that shoulder to lean on, and they might feel burdened taking care of this child alone. And they also go through the emotions of isolation and sometimes self-doubt about if they're doing the right thing in raising their child, or if they could, they will be doing the right thing or the wrong thing if they were to set the same standards of, let's say, discipline for this child who is unwell. And so they end up feeling also guilty of not being capable of fully taking care of their child. And when we talk about grief, someone called Kubler-Ross came up with a model that explains what people go through when they get a physical diagnosis. It is expected that once a diagnosis has been made, someone might go through perhaps denial and say to themselves, no, this cannot be. Maybe I will get a second opinion. It could be something else, or it could be even nothing at all. Or go through anger, depression, begin bargaining with God even. Saying things like, God, if you take this away, then I will do 1, 2, 3, 4. Just trying to make sense of what has just happened or the diagnosis they just received. And so it's quite a journey for someone to reach the level of accepting where they are. But you'll notice what people, the warrior could be going through, and some caregivers, is that it's all juggled up. In a day, they could be going through anger, depression, accepting, and also denial, or even bargaining. Or in a few weeks, in a month, they could be going through these emotions. And therefore, what normally is expected is that someone, let's say for some time, has been angry, going through, and it's understandable they're angry because of the loss or the frustration of dealing with the pain, with the illness. But then when these emotions keep changing in this manner within a short period of time, it becomes quite unbearable. for the warrior, and for the caregiver. And so how do we help a child who has lupus, living with lupus? For young children, through play therapy, as I also heard the doctor speak about, you can also encourage them to do some procedures in their dolls. This way, explaining to them and pointing out areas, or asking them to point out areas they could be feeling pain, and what the child could tell their doll in the imagination. This way, the child would learn how to understand what they are feeling and acknowledge what they are feeling, and also be patient with themselves. Sometimes someone who has a diagnosis might want to get well so quickly that they're not fully aware of where they are or what exactly they are feeling. It is also necessary to encourage the child to draw and color. It tells a lot of stories. They can explain to you what they are feeling. They can express their emotions through art therapy in the case of my profession. And also rewarding the child with stickers, perhaps. Once you've gone for your medical checkup and the child was able to bear it and they feel positive about the process, you can always reward them in one way or another. It doesn't have to be only stickers. And also reading to them storybooks about children who are going through challenges with their physical health and how they've been able to overcome that. For adolescents, it's necessary to involve them as much as possible. Discuss with them what they are feeling, what they are going through, involve them in the decisions they make about taking care of themselves. It also helps in them retaining the process of the treatment plan that has been set for them. And I imagine this is the one point that some people might be able to, may be suffering from, or finding difficulty, that is following through long-term treatment plan. So when you involve them, they feel it's their journey, and they will be able to own the process. They will be able to put themselves into taking the right measures and decisions. And also, as much as the child, the adolescent, is living with lupus, it is important to discuss and also set behavioral expectations and boundaries. I imagine this is quite challenging for parents who have one child who's unwell and the rest are okay. It becomes difficult, especially in terms of discipline. You wonder how you're going to do with the child. And therefore, it's an avenue to discuss with the child what is expected of them. But it's also important to be aware of some emotional and behavioral signs for children and adolescents. And with these signs, it might call you to seek a different kind of help. It might call you to see a counseling psychologist. Some children between the ages of 3 to 10, you find a child is stressed, constantly preoccupied about their health, concerned that their parents or siblings will also become sick, or they are not getting quality sleep because they are afraid about something. When they go to sleep, or they might not wake up, they're just disturbed and they're not having quality sleep. This also would affect their eating habits and just general well-being. When you notice that at school, their behavior has changed, they are having outbursts, they are fighting, this is a pointer that they're struggling emotionally. And also, whenever they think about going to visit the doctor and they have an outburst, it's important to calm them down, explain to them, listen to them, find out what is making them feel that they don't want to engage. And also, when you notice that the child is having other physical symptoms that are not related to the disease, it's important to speak about this to the doctor. And for adolescents, it's the same with adults. You find there's difficulty socializing. They withdrew from peers. They even avoid conflicts. Conflicts are not always bad. Some can be healthy in helping people understand each other. And you might notice they are falling into depression, meaning that things, activities they used to like, now they're not interested anymore. They don't want to engage. You might notice their schoolwork is being affected greatly because they can't concentrate, or there are those feelings of hopelessness and even helplessness. It's important to seek help when you notice this. And to deal with the loss and grief of health, because it is a loss and there is that sense of grief. It's important to be at a place where you're present with what is happening, being in touch with what you're feeling in the here and now. As an adult, having clear understanding of what you want about life in terms of your values. Yes, there is a diagnosis, but that does not mean your life ends there. It's very possible to have quality of life, which means as much as someone is going through treatment, they also need to have the knowledge that they have a quality life that they can still live if they put their concentration there as well. And so be also committed in terms of achieving goals, but then set for yourself realistic goals. Once you're able to understand the disease, once you're able to understand your capabilities, it's necessary to set goals that fit within your physical well-being. And also constantly reminding yourself that you're here. Yes, there's a diagnosis. Yes, you're living with lupus, but you're here. And being here means you have a contribution in this world. And yes, there are days that are going to be challenging, but there are others which are going to be good. And also having the ability to recognize thoughts that cross through your mind that are negative, that keep you held back from engaging with the world, with the environment. It's necessary to challenge those negative thoughts. And by the time you go through this cycle and come to the point of acceptance, it is the point of realizing that you cannot avoid the diagnosis that you have. You cannot escape it. It is there. And allowing it to be part of you. Most of the struggles that people go through is because they keep denying that something exists. But the moment you acknowledge that this is where you are, the moment you accept what you're going through, it becomes easier to manage and deal with any stress. And so for the caregiver to manage the stress, it's necessary, it's actually vital to learn about lupus and what to expect from it, to understand its nature, to understand how to manage it, to gain knowledge about the medications and their side effects, and also learning preventative methods so that some symptoms can be kept in control. And another point that is so important is ask for help. I know around us within the family or the community, sometimes someone might feel I'm burdening another when I ask for help, or I've asked for help so much, maybe someone would not be willing to support me once again. It's necessary to challenge those thoughts. If you need help, please ask for it. Sometimes even ask for help so that you can take a break as a caregiver. Take a break for self-care. Take a break and just go for a walk, go for a retreat, something. But ensure you find a way of reconnecting with yourself once again. Join a support group. I love what Dr. Migowa has said, what the organization is doing, in that there are those events which are free to educate the public, and there are support groups also. And therefore, join a support group as a caregiver. You're not alone in this. And there are so many people out here where you can learn from through their experiences. Take care of your health. Do physical exercises. Eat well. Sleep well. And also evaluate your resources. That is spiritual resources. As we had said earlier, living with a diagnosis affects us in different levels. And so if you are a person of faith, if you are a person of convictions, you can tap into that. If you are a believer, you can join with others and continue in your spiritual journey. Prayer. When it comes to personal resources, look at your inner strength. You are strong. You have unique qualities, unique capabilities, which you can use as means of support for yourself and the person you're taking care of. What skills do you have that can help you cope and manage with what is happening with your child or even with yourself? When it comes to community resources, we are talking about seeking medical assistance, seeking psychological assistance. If you're struggling financially, which are these places that you can approach so that you can be assisted? If you like information about lupus, who would you approach? Where can you go? And sometimes someone might find themselves, they need legal support. Is there a place that you can approach for these services? And therefore, there are resources around you. What is important is you acknowledging them, being aware of them, and seeking out many more that you can utilize in the journey with your child. And as I conclude, I'd like to remind all of us that our thoughts create the feelings that we have. The thoughts we have about life, the thoughts we have about a diagnosis create the feelings that we have. And if thoughts create feelings, feelings create behavior. As we have seen, if someone has not accepted a diagnosis, they might self-isolate. And when they do that, they withdraw from society. And by doing that, they are reinforcing the thoughts that they have. So it becomes an ever-ending cycle which is very unhealthy. And therefore, what I would encourage is always challenge any negative thoughts that come to you. Sometimes we have automatic thoughts which just flash. Other times we have those thoughts that remain with us, but they are not helpful. I would encourage challenge those thoughts. Where is the evidence of that thought? And the moment you do that, you'll notice your emotions change. And when your emotions change, you will notice that your behavior changes. If, let's say, you're struggling at work because of how your body is feeling, you're struggling at school, when you challenge any negative thoughts that you have, you notice you're having some level of energy and you're feeling a bit positive, and you can still engage. And so up to this point, I am grateful. Thank you so much for listening. And back to you, Hilary.
Thank you very much, Caroline. That was a very, very wonderful presentation. At least we've learned now both sides of the challenge of the warriors and the caregivers in the psychological health journey. So now I'd like to open up the floor to any participants who might have any questions, any comments, or if there's any engagement you would want now. If maybe Caroline, you have a question for Dr. Migowa or the other way around.
I think for me it's to thank Caroline for highlighting what I said is the silent burden that many people don't address. And I always find that that's the most challenging part of the management. Giving the medications is a bit easier because you see the signs and symptoms, you see the features on the skin, the swollen joints. So people are motivated, right, to make sure the skin is back to normal, that the joints are not painful and swollen. But as Caroline has highlighted, there are deeper wounds emotionally, psychologically. And I think one thing that we have to strive for is multidisciplinary care, right? Where a one-stop shop where our patients can get all these services together. So thank you, Caroline.
Thank you, Dr. Migowa.
So yeah, now we'd just like to open up the floor. Anybody, any one of our participants has a question, has a comment. You can ask even questions in the meeting chat if you're not voice ready, you can just type your question in the chat and we'll relay it here now in the group.
Hilary, I have a question for Dr. Migowa.
Okay.
And yes, Dr. Migowa,
Yes.
What is the onset of lupus?
Wow, that's a good question, Carol. I've seen lupus in a child as young as 3 years old. And for us in pediatrics, we cover everybody from 0 to 18. So the youngest I have seen, and this was here at home, was a child who is 3 years old. And normally when we see that, as I was talking about your natural army, your KDF, we really worry about the whole programming of that army, because when you see lupus that early, then chances of other problems coming because of a malfunctioning defense system are very high. So they need to be monitored very closely for other conditions like diabetes, other things like arthritis, because it's likely to creep up in due time. So the youngest I've seen is a 3-year-old girl. Yeah.
Thank you.
Yes, I see there's a question. Does lupus in children affect boys? Oh yes, Doreen, it does. It does. And I think they are worse off than the girls because people still have the perception that lupus doesn't affect boys. I know a particular boy who I've been trying to convince the parents to get him on treatment. It's now been a year. and they keep repeating the tests, hoping that they'll be negative. But if anything, they keep becoming more strongly positive. So it does affect boys, because those abnormalities in the defense system, that derangement, is not just unique to the girls. Yeah, so it does affect boys. What we know is that the hormones in ladies and girls can put you at a higher risk, right? So that's why you see most lupus cases tend to be in the ladies or young girls, but the boys also do get lupus. Yeah.
Very good question, Asante sana. I wanted to maybe raise a question for both of you, Dr. Angela and Caroline, from your experience, because my background is in insurance. So I wanted to find out now what's your experience with insurance companies dealing with lupus sufferers, lupus warriors, when it comes to the disease, how it exhibits and how they deal with it. Or if there's a place where they can get even coverage with relative ease, even here locally.
That's a good question, Hilary. And in the spirit of universal healthcare, where the philosophy is nobody should be impoverished in their quest to seek help. That's the underlying principle in universal healthcare. Now, most of the private insurances do cover especially the diagnostic workup. I think because maybe at that time people are still not so clear what's going on. The challenges come sometimes in the treatment, because the treatment is often long-term. And like I have patients who come to me all the way from Moyale, others Kajiado. So when I give them a prescription, for example, I give them a prescription for like 3 months, because it's not practical for them to come back every month. But then you find the insurance does not approve that. So these families have to get a proxy in Nairobi sometimes, or travel back every month to get the medication. So that's one hurdle I've noticed. Another one, which I find very unfortunate, is the insurances trying to decide where they should get care. And it's my hope that the insurance companies can do what I would say a professional mapping. Map the country and see which professional sits where. Because as it stands now, in Africa, we are about 15 pediatric rheumatologists. So we are not many. And in East and Central Africa, we are only 2. And the 2 of us are in Nairobi. So when a patient presents with arthritis, honestly speaking, why do you want to insist for them to go to a facility where there's no rheumatologist? They'll spend money there. Time will be lost. There's a risk of misdiagnosis. There's a risk of mismanagement. So I hope that the insurance companies can also just map out and see, okay, for people who have got heart problems, which are the centers that have the specialists? If there are patients who have got cancer problems, which are the centers? It's actually a saving for the insurance, so that people don't spend unnecessary money and lose time, which affects ultimately the outcome of the patient. The other thing I've noticed, NHF actually most of the time is quite good, but I know that might change. So I don't know what Carol's experience has been, especially for the psychosocial support that's very critical for these patients. Thank you.
Thank you, Dr. Migowa. Thank you, Hilary. What I would say is that there's always that push back and forth. Some insurance companies would pay, others would not. And so what I've seen so far is an increase in stress and dealing with their mental health, because patients are left feeling, or even caregivers are left feeling unsupported by some of the institutions that they have, they are part of. So what I've noticed so far is some insurance do cover, others don't. Others, they request the client to pay cash, then they can get a reimbursement. But then sometimes you find that client at that moment, they don't have money. This is added stress. So it has been a challenge trying to support, especially those clients who are having financial difficulties. And as we know, even psychosocial support is quite expensive nowadays, and those who can be able to pay for it. So I've noticed both, that some insurance pay, others don't.
Thank you very much. I've also seen a few more questions that have come into the chat. The first one from Yogi, who was asking whether lupus is hereditary. I don't know whether that one is for Dr. Migowa.
Thank you. Thank you for that. Now, the issue of any disease being hereditary is quite an intricate aspect of medicine. And there's a whole specialty called genetics about that. And most of us, like the color of our eyes, our height, is determined by the genes we got from both our mother and our father. Now, the genes that you get from both your mother or father can either be dominant or subdominant, all right? Now, in the initial diagram that I showed you, was trying to explain the disease process, the natural defense of the body, your KDF, your immune system, involves so many cells which produce so many weapons. So you can imagine the number of genes involved, right? There are many. We haven't even finished discovering all of them. But what we know, and it's what I was alluding to when Caroline asked me about the age, when we see lupus in children under the age of 5, right? Because it's not typical. It's not typical for it to happen under 5. But when we see it under the age of 5, we then suspect that one of the weapons used in fighting infections, or one of the weapons your army uses, there's special proteins called complement. The information out there is that there's a problem with that aspect of the army, with that particular weapon of the army, the complement system. In that complement system, there are very many genes that are also involved in it. So it's normally very hard to pinpoint and say, so did it come from the mother or did it come from the father, unless you have somebody in genetics who can do it for you. But that's the information we have. Another flip side to this issue of heredity is, I'll give you a case of a teenage boy I saw. He was already known to have diabetes. He was 16. He was already known to have diabetes. And he developed this new onset hypertension, right? And then when we started taking the history, we found that the father had many other autoimmune diseases. These are diseases where your army attacks you. His grandfather had many other autoimmune diseases, his cousins, his brothers, right? So we could clearly see, on the side of the father, there are many relatives who are having, it was not necessarily lupus, but other autoimmune diseases. So from there, you can only imply that clearly there's a genetic risk that can be passed on. But like I said, it's critical to get an expert to pinpoint which gene, and again, to tell you what is the chance, what is the probability, what is the risk of passing it on to the next generation. Thank you.
Asante sana. There's also another question, maybe that loops back to the previous one, of whether it affects boys or girls. So Agnes was asking, maybe it's more attached to the chromosomes thing.
Not quite. And I'm trying to see if I really have that diagram here. Unfortunately, I do. So maybe let me just quickly share, if you don't mind, and just to explain the issue of where the hormones the issue of female-male comes in. Now, the way the soldiers in our natural army work, just like the way our KDF works, the most important initial task is to identify the danger so that you respond appropriately. Now, to identify the danger, our immune cells, or the soldiers in our natural army, have like antenna, and it's what is shown like in this red diagram, I mean this red structure here. Yeah, you can think of it like an antenna, like, you know, when the mobile phones first came to our country, we had those big phones and they had an antenna. So the soldiers in our natural army also have a unique antenna that allows them to identify the threat to the body. And this antenna in the field of immunology, which is the field that looks at diseases where your defense is not working well, where your immune system is not working well, they are called toll-like receptors. So this antenna, in the environment of the hormones produced by ladies, right? These antenna increase, yeah? They increase in number, they increase in their effectiveness to identify, right? And those hormones are like the estrogen in particular. And for that reason, it is why lupus seems to be more predominant in girls and ladies compared to boys and gentlemen, because the hormones we produce increase this antenna and their capacity to identify threats. So then your defense system overreacts, right? Leading to the signs and symptoms of lupus. So I don't know if that helps. I hope it does.
I'm sure it does. I'm sure it does. There's also a question here from Duncan, who was asked, due to the increase in cases noted, could there be other environmental factors at play?
This is a key question we've been asked. We are battling with ourselves, and it's one of the things when I said future directions. It's one of the things we hope to tackle in the research front, to find out what in our environment are triggers that may increase the occurrence of lupus. Now, the other question, in science, we always ask, we interrogate. So the other question is it really that the number of cases of lupus have increased, or is it that the awareness is better and the diagnostic approaches are better, so we are picking more cases, right? That was one possibility. The other possibility is that truly there's an increase in lupus cases because of the environment. We don't have any local data from our region to say yes, because the environment has changed, we are seeing more cases. But I'll give you an example from something very different, and why this question Duncan has asked is key for us to research on. I have some colleagues who are looking at climate change and maternal child health, and they have found, and this is data from Kenya, I think they did the study in Kilifi, they have found that the increase in our environmental temperatures, for example, is leading to a higher rate of miscarriages. So there are many more women now having miscarriages, losing their babies before delivery, purely because of increase in environmental temperature. So if that subtle increase in environmental temperature can have such a huge impact on the sustainability and survival of the baby in the womb of the mother, can you imagine how much more it might be impacting other aspects of health, which we don't know? So it's really a fascinating area to be pursued from a research point of view. Thank you.
Thank you. Then there's a question also from Doreen. This one, it might be for Caroline. How can one navigate the stigma associated with lupus, especially in schools or the workplace? Because now many people don't really understand the disease. Maybe the name even gives them certain ideas, certain preconceived notions of it. So, how can how can people navigate that?
That's a great question. Thank you, Doreen, for the question. Thank you, Hilary. And just like any other stigma, the way to deal with this type of stigma is, first of all, to have knowledge and facts about lupus. It's very important for the individual, first of all, to have information about the disease. What is lupus and its nature? The moment you understand it, it becomes easy to educate others. But before someone moves to educating others about something, it's necessary to observe your own attitude towards the disease. If you notice that your attitude is negative, it becomes easy to self-isolate. You find you're even avoiding people at the workplace or even at school because your thoughts about the disease are negative. And therefore, if you change your attitude and get a positive mindset, it becomes easy to educate others, to create awareness, like what we are doing right now. And therefore, to navigate through that, it's important to first of all understand what lupus is, accept the diagnosis, check your attitude, and then create awareness, educate others, and also join social support groups. It's a great way to navigate through the challenge. Thank you.
Thank you very much for that. Even related, I guess, with this, maybe this is now a different, a separate question from that. I don't know whether you're familiar with other people, other famous people who might also be diagnosed with lupus, because you know the way it presents so differently in so many different people. Because like even for me, the only maybe famous case that I know is the musician called Seal. He sang a song for a Batman movie many years back. I'm also showing my age there, but I remember now the butterfly, the butterfly rash. That one, that at least I can recognize that from him. But I don't know whether you know others who might show different forms of lupus.
Yeah, so I can come in. Starting at home, we had our very own Lona Irungu, who was a media personality, and she really did a lot to raise awareness. But she battled it, and she was even able to have her family. Yeah, so that's Lona Irungu. There are other personalities in the showbiz business, like Toni Braxton. That's a singer. Lady Gaga is also somebody who has battled with lupus. Selena Gomez has also battled with lupus. So there are quite a number. But I know in Kenya that Lona Irungu is the one I can speak about. I'm happy to hear about others that people might know of. Thank you.
Sandy, there's also a question here from Khadija, who is asking is it possible for the skin, when there's been an outbreak of the discoloration, is it possible for it to go back to its normal color? And if yes, how?
Oh yes, Khadija, it does go back completely to normal if on the right treatment and if we employ the proper preventive strategies. So I keep reiterating the issue of protection from the sun is key. It's very, very key because that helps to mitigate the disease worsening. And then the medications we give, like hydroxychloroquine, is a very good medication for the skin. And here is where we work hand in hand with the dermatologists, the skin experts, because sometimes there are some ointments that can help us get the skin back to normal. But you see, at the end of the day, Khadija, the fundamental issue here is the army of the patient, the natural army of the patient, that which we call the immune system, is fighting the skin. So even as we treat the active symptoms, fundamentally, it's to tame that army, tame it completely so that it stops fighting the skin. And this is why now the field of rheumatology comes in, because that's what we keep doing, right? Trying to tame that army so it stops fighting any organs in the body. But yes, the skin does go back to normal with sun protection and medications, yeah.
Yeah, you can, if there are any more participant questions, please keep them coming. We have a bit more time where we can at least have our speakers together. Doreen has also asked, as a follow-up also to this question from Khadija, is it possible also for hair loss, to reverse hair loss that has happened as a result of lupus?
Yes, it does happen. And that reminds me, there's a young girl I followed up from Kajiado. And when we started with her, yeah, she was quite unwell and she couldn't even braid her hair because it would fall off. But she's done very well. The parents have been very supportive. Initially, we would see her every 2 weeks. That's how critical she was. But now she's so stable. We see her once a year. And her hair grew back. She's now able to braid her hair, hold a ponytail, like other girls her age. So at the end of the day, it boils, and that's why I went through trying to explain the fundamental problem. Because until we are able to control that natural army, which we call the immune system, and tame it so it stops attacking the body, right? Everything else we do will be in vain, because you will treat the skin, but as long as the army is still hyperactive, it continues attacking. So it's possible. The hair grows back, the skin regenerates and comes back. What is critical is prevent the disease from worsening by sun protection and collaborate with your healthcare provider, whether it's a rheumatologist or pediatrician, to ensure that the medicines are being taken well and that they are helping to control the disease process. Thank you.
Thank you. There are two maybe questions you could probably handle back to back. So there's the one from Rita asking on maybe support, direct support for friends and family with lupus, maybe first line support. What can you do for them? How can you help them? And then another question, I'm not able to read the name, but they're asking about the lack of appetite. What if somebody is not able to eat properly and they have a bit of anger management problems? What can you do to deal with such an issue?
Maybe I'll let Cairo handle the appetite and anger management. But what we know, the disease, just like the way we feel when we have a flu, when you have a bad flu, you don't feel like eating, your body aches everywhere. That is what the children experience. Yeah. And that can explain the poor appetite. So as we treat, ideally the appetite improves. But we have to be aware that the appetite could be affected not just because of the disease, but other psychosocial factors. And perhaps Caroline can shed more light on that. Thank you.
Thank you, Dr. Migowa. Thank you, Hilary. On the question of supporting families who have someone living with lupus, it's necessary to understand what they are going through. And what do I mean? Understand what lupus is. You see, I've noticed that people want to help, but it becomes challenging to help where you lack knowledge or you don't have information about something. And therefore, as an outsider, learn about lupus. And then within yourself, what resources do you have that can support this family? It could be something like, for example, a parent who has a child and they have a busy schedule. How can you come in and support? It could be at times just, making a courtesy call. It actually depends on the environment and looking at the resources you have, given the knowledge you have about lupus, and then finding a way to support. And therefore, there's no blanket ways of supporting, because families are different, people are different, but it's necessary for you to know what your resources are and see the kind of need you can feel for this family. And the other question about anger management and someone refusing to eat, just as Dr. Migowa said, when you're in so much pain, when you're struggling, it affects the appetite. But then, depending on the age of this child or this individual, reminding yourself the grief stages. This person who is having so much anger to the point that they're refusing to eat could be an unconscious form of wanting themselves to feel even more pain. Because what else can they do? They feel hopeless. They feel they've reached the end. And therefore, they could be going through depression. And dealing with that means you need to be patient enough to understand what it is they could be thinking about or feeling as a result of lupus. And therefore, opening up channels of communication to understand what exactly they're experiencing. If it's someone you're living with, it's a child, it's an adolescent, and they say they don't want to eat, they've not eaten for hours, it's necessary to come to their level and to just listen. Sometimes even being just present is enough for the person to, resolve any negative thoughts they could be having. It's not easy. What I can say, it's not easy dealing with a loss of capability. When someone feels they are not capable of achieving something they hoped to achieve, it is so stressful that sometimes they sabotage themselves. So it's not that this person is doing what they are doing by refusing to eat. It's not that they are doing what they are doing because they want to. They are in a state of loss. They're in a state of trying to understand why them, why they're feeling the way they're feeling, what they can do about it. And when they are that hungry to a point of refusing to eat, it means then you can even seek support from a counselor so that they can journey with that child or that individual. Thank you.
Thank you, Caroline. That was at least very, very clear. There's one more question here from Hadija. I was asking, now that she has a baby now and she has lupus, going back to the question of heredity. If she has a baby now and she has lupus, will her baby have a high chance of also getting it as well?
Okay, Hadija, thank you for your question. And I think I would answer this by saying that I would advise, I don't know you're in which city or which town, but it would be important to have your baby evaluated because there are certain things we look for in the physical assessment of the child. And then there are a few tests we ask for to check if the baby is at risk of developing lupus. But what we know, and this is important for Hadija because she might be blessed with another baby in the future, what we know is that when the lupus is well controlled in the mother, right, before conception and during the period of the pregnancy, the chances of the baby getting complications or getting the disease are much less, right? So it's important that you work hand in hand with your rheumatologist to try and get good control of the disease before conception. And depending on how the disease is, sometimes there's some medications they might give you to protect the baby. So I would advise, please visit the closest pediatrician to you. Let them know you have lupus. There are certain things we normally assess in the baby to make sure that they're fine and there's no risk of them developing a lupus and lupus-like features.
Thank you for that. Just as a quick maybe last round, if there's any more questions from the participants, if you don't mind, you can put one last round of questions in the chat. Then I guess we'll now be able to wrap up on time and also be able to release our two speakers here for the day. But in the meantime, I just wanted to at least give my thanks both Dr. Migowa and Caroline for being with us here, taking us on this journey, at least to both teach us and give us stories of other young warriors living with lupus. And at least through this, your presence, your knowledge, your stories, and your support, at least we have filled people here in this group with some knowledge. At least they know that they're loved and they're filled with also some courage from here. Hand over to Edward, my colleague Edward here, to give at least a quick vote of thanks. Then maybe we can wrap up. But if there's just one last call for questions. If nobody else has any questions, then I'll hand over to Edward. It seems we're okay.
All right. Thank you, Hilary. I appreciate the great moderating that you've done. And I want to give our hearty thanks as Lupus Ascending Foundation to our esteemed guests, Dr. Angela Migowa, and also Caroline Okumu, who is a counseling psychologist. And we are extremely grateful for your time, your expertise, and also for the care that you've taken in answering the many questions from our participants today. We're also grateful for Khadija and her questions, as well as Rita, Doreen, Duncan, Yogi, Agnes for her engagement in the chat. And we want to ensure that going forward, we want to continue doing such events. And we welcome everyone to come in and join our pages and the like, and let us know what else you'd like to know about lupus and awareness and things that we need to focus on as well. So I want to say that without further ado, that we can end the session, and I wish you all a wonderful weekend and enjoy it, have fun, and we remain blessed. Thank you so much.